It's the time of the year when the weather is getting nicer and everybody is itching to get outside. Joining me now is Virtua surgical specialist Dr. Arnold Baskies to talk about how to protect your skin, to talk about melanoma, which, by the way, affects so many people.
It does. This year alone, we're going to see 5 million skin cancers, about 76,000 melanomas, and about 14,000 people will unfortunately die of melanoma, which amounts to about 40 people a day.
Wow.
So we're dealing with a real epidemic in terms of skin cancer, and it's something that we can do to stop. It's a preventable type of cancer.
And one of the easiest things people can do to help themselves is to apply sunscreen. I mean, it's changed so much, the talk of sunscreen, and you don't even really see 15s out there anymore.
No,
I mean, higher numbers are out there.
And we shouldn't really be talking about 15. If someone's out there playing golf or participating in any kind of activity, the minimum they really should be using is SPF 30, not 15. 15 is adequate, but 30 would be better. And the reason for that is very simple. People tend not to put on enough sunscreen. The amount of sunscreen that we should be using is about a shot glass to cover the average size body. So in this country, we're using much less sunscreen than we should on average.
And how often should you reapply if you are golfing or if you're out, for hours upon hours each day?
In an active situation, sports-wise, people should be reapplying their sunscreen every 2 to 3 hours.
Is there such a thing as good sun exposure?
There really isn't. There's no amount of sun exposure that's safe, and in fact, the worst sun exposure is the type that we get in the midday sun. Midday sun is the worst type of sun exposure you can get. If you look at the Hollywood starlets, for instance, they avoid the sun altogether because you not only get the skin cancer type problems, but you also get photoaging. The sun is very, very deleterious, very harmful to the skin in general.
So I am one of those. Many people who know me will tell you that I basically apply a bottle of sunscreen a day, especially when I'm in the sun. I have moles all over my body, so it's easier for someone like me to spot different marks. But if you're unsure what to look for, how do you go about doing that?
Well, we talk about the ABCDs of skin cancer. Any mole that has changed, any type of skin eruption that looks suspicious to anyone, either you or your loved one, should be checked. But in general, if you see a mole that's changing, if you see a mole that isn't symmetric all the way around, if it has an irregular border, if its color is dark, very dark, or it's changed at all, then bring that to the attention of your dermatologist or your primary care physician. And if it's getting bigger, don't ignore it.
Okay. Very good advice. Thank you so much. And make sure you wear that sunscreen. Dr. Arnold Baskies of Virtua, thanks for joining us.
Thank you very much.